Alright, so today we're going to go over the health assessment textbook, more specifically Chapter 17, the nose, mouth, and throat. These are the main parts that I thought were important. This chapter, it was mainly focused on abnormal findings. I mean, there were some assessment techniques to do, but they're just kind of, you should already know how to do them. It's kind of prior knowledge, weren't too bad. So let's just get into this. So the nose, there's a septum in the nose. What is a septum? This basically divides the nasal cavity, okay? And then we also have something, it's called the Kieselback plexus. All you need to know about this is the main site for nosebleeds. Also, what make up the nose are the superior, middle, and inferior turbinates. They function to increase surface area, which allows the blood vessels and mucous membranes to warm and clean the inhaled air. Too bad. You got paranasal sinuses. They make the skull bones lighter. They serve as resonators for sound production, and they produce mucus which drains into the nasal cavity. Then we have 4 pairs of sinuses. We got frontal, maxillary, ethmoid, and sphenoid. There are 2 that can be seen upon examination, and those 2 are going to be the frontal and maxillary. Then we have 2 that are present at birth. They're the ethmoid and maxillary. I do so believe. Yes, I am correct. Now let's move on to the mouth. In the mouth there is something called the frenulum. That's basically, you stick your tongue up, and that little midline thing, that basically connects the tongue to the roof of the mouth. It's pretty cool. Also have salivary glands in the mouth. We have 3 pairs. We have parotid salivary gland, submandibular salivary gland, and the sublingual salivary gland. All these produce saliva, and saliva is a clear fluid that moistens and lubricates the food bolus. It starts digestion and cleans and protects the mucosa. Moving on to cultural and genetics, there are 3 things that I want to focus on here. You got the bifid uvula. It's basically when the uvula in the back of the throat is split. Then you have the torus palatinus. It's the hard palate in your mouth. It's got like a rigid bone that runs straight through the middle, the hard palate. And then you got leukoedemia. It's kind of like a blue, whitish, opaque color of the buccal mucosa. So let's move on to the teeth and gums. It shouldn't be too hard. What should the condition of the person's teeth be an indication of? We learned this about this health assessment. It's their overall health. Pretty easy. And so I put here leukoedema is found here in the buccal mucosa. Also in the buccal mucosa you can have fortis granules, which are small isolated white or yellow papules on the mucosa of the cheek, tongues, or lip. And you also have leukoplakia. It's like a white chalky raised patch. Then we go on to the palate, which the torus palatinus is found here. And then the question here is like, what cranial nerve is being tested when the person says ah? It's the 10th cranial nerve, the vagus. Alright, moving on to tonsils. We have to focus on this. I'm going to zoom in this. We must know this. There's going to be, she says there'll probably be a question on the 1, the 2, the 3, and the 4. If it's 1, that means they're visible. Like to here is visible. 2, it's between the uvula and tonsil pillars. 3, it's touching the uvula. And 4, touching each other. You want it to be a low number. So let's look at expectant throat. How can you help someone whose gag reflex is easily triggered? Give them the tongue depressor so they can depress their tongue down by themselves. Then halitosis, that's a breath odor. Let's look at some nose abnormalities. What is this? This is seasonal allergic rhinitis, AR, or hay fever. Seasonal allergic rhinitis. Characteristics: it's basically a regular immune response caused by a trigger. Some of the triggers could be rhinorrhea, itching of the nose or eyes, and nasal congestion and sneezing, etc. So this is acute seasonal rhinitis. What is this? This is acute rhinitis. This is non-allergic, so this isn't to do with a seasonal or anything. And it's basically a rhinorrhea which becomes purulent. So it's To be more specific, it's a clear watery discharge with rhinorrhea, which becomes a purulent caused by like sneezing and nasal itching as well. What is this? This is perforated septum, usually caused by taking drugs and stuff to the nose. What are these? These are nasal polyps. These are smooth gray, pale nodules, which are overgrowth of mucosa. Smooth gray, pale nodules, overgrowth of mucosa. Yep. Well, this is pretty easy. The lip, you can tell, cleft lip. Pretty neat. This is kind of interesting. I thought it's angular cheilitis. It's kind of cool. You got arrhythmia, scaling, and shallow and painful fissures all on the sides. It's kind of cool. So it's a cheilitis, angular cheilitis. Yeah, redness, pretty easy. This one's a carcinoma. I do so believe, yes. It's initial lesion. It's round and durated. Then it becomes crusted and ulcerated with an elevated border. This is crusted on. Not too bad. What is this? I forgot. It's a retention cyst, a mucocell. I don't know. Pretty neat. It's just a translucent nodule, really. This is a retention cyst. So let's look at teeth and gum abnormalities. This is the baby bottle tooth decay. Basically occurs when babies stuck on like orange juice bottles or milk bottles for over like a year, prolonged over a year. This is dental caries. It's basically a progressive degradation of the teeth. Basically, it's breakdown over time. This is a tooth avulsion. Pretty neat. Like trauma causes it, and then the root and the teeth come out. However, you can put it back in place somehow. I don't know you can do that. It's pretty neat. This is Epolis. It's a benign, non-tender, fibrous nodule of the gum seen emerging between the teeth and overgrowth of vascular granulation tissue, basically. Nodule gum. Pretty easy, pretty cool. Swollen gums, you can tell. And this is a gingival hyperplasia, I think. Let me see. Yeah, gingival hyperplasia. Probably saying it wrong. It's swollen gums, really. This is kind of easy. Oh my gosh. Gingivitis. Basically, you got inflammation and bleeding, really. Now let's look at buccal mucosa abnormalities. This is like a pathos ulcers. It's like a canker sore. It goes from a vesicle to an ulcer. This is a canker sore. Kind of neat. This is but that's to do with measles, complex spots and measles. Small blue-white spots with irregular red halo scattered over mucosa opposite the molars. Kind of neat. This is hyperplakia, I think. Leukoplakia, my bad. And it's a chalky, white, thick, raised patch with well-defined borders. It does not scrape off. Chalky, white, thick. And you got to know differentiation between this one. I honestly forgot the name of this one. Candidiasis or monoleal infection. It's a white, cheesy, curd-like patch on the buccal mucosa and tongue, and it scrapes off. Okay. Tongue abnormalities. This is that ankyloglossia. Basically, it's the frenulum that we talked about that holds this. It's short, really. This is a geographic tongue. It's pretty kind of cool. And it kind of looks like a map, and it changes over time, which is kind of neat. This is a smooth, glossy tongue, atrophic glophitis. Smooth, glossy tongue is just like kind of slick and shiny, kind of neat. This is like a black, hairy tongue. That's what it's called, yeah. And it's not hair, but elongation of filiform papillae and painless overgrowth. Kind of neat. This is a fissured or scrotal tongue. Kind of neat. Just kind of deep furrows divide the papillae into small irregular rows. Kind of neat. This is a enlarged tongue. You usually see this with Down syndrome. Moving on to oropharynx abnormalities. This is a oral Kaposi sarcoma. Kind of cool. It's kind of like a bruise, reddish blues like thing. Or Kaposi sarcoma. Kind of neat. This is a paratonsillar abscess. It's kind of neat, I guess. I don't know. Kind of cool. And this is acute tonsillitis and pharyngitis. You can see all that. Jesus. All swollen and there's white stuff. Now I want to go over these key points. So, we know the nose is the first segment of the respiratory system. It warms, moistens, and filters inhaled air and is the sensory organ of smell innervated by cranial nerve 1. Externally, the nose is shaped like a triangle. It consists of a bridge, a tip, 2 nares, and a columella that divides the nares into 2 ala, or wings, at each side of the nose. Internally, the nasal cavity extends back over the roof of the mouth. Nasal hairs and ciliated mucous membranes filter dust and bacteria. The nasal mucosa has a rich blood supply, and the septum divides the nasal cavity into 2 air passages. The anterior septum holds the Kieselbach plexus, most common site of nosebleeds. The turbinates are bony projections that help warm, humidify, and filter inhaled air. Sinuses drain into the middle meatus, and the nasolacrimal ducts drain into the inferior meatus. This shit is long. Holy cow. Oh well. Paranasal sinuses are air-filled pockets in the cranium. They lighten the weight of the skull, serve as sound resonators, and provide mucus. Mouth is the first segment of the digestive system and an airway of the respiratory system. It also contains taste buds and aids in speech production. The oral cavity is a short passage bordered by the lips, hard palate, soft palate, cheeks, and tongue. The mouth includes the tongue, 32 teeth, gums, the uvula, and opening of the 3 pairs of salivary glands. The glands secrete saliva, a clear fluid that moistens and lubricates the food bolus, starts digestion, and cleans and protects the mucosa. The throat or pharynx is the area behind the mouth and nose. Kind of easy. The oral pharynx is separated from the mouth by folds of tissue on each side, which are the anterior tonsillar pillars. Behind these folds are the tonsils, masses of lymphoid tissue. The nasal pharynx is continuous with the oral pharynx and contains the pharyngeal tonsils or adenoids and the Shin2 opening. The nose, mouth, and throat undergo certain developmental changes. By age 2.5, children have 20 deciduous or temporary teeth. These teeth are lost between ages 6 and 12 and replaced by permanent teeth. In pregnant women, nasal stuffiness and epistaxis may occur as a result of increased vascularity in the upper respiratory tract, and gums may be hyperemic and softened. In aging adults, loss of subcutaneous fat may make the nose appear more prominent. Older adults also may experience a decreased sense of smell and taste, as well as tooth loss, which can contribute to nutritional deficits. Now this is okay. To obtain subjective data about the nose, ask about discharge and frequency of colds, sinus pain, trauma, nosebleeds, allergies, and altered sense of smell. Questions about the mouth and throat, sores or lesions, bleeding gums, toothaches, hoarseness, dysphagia, altered taste, smoking, and or alcohol consumption, dental care. When assessing children, ask about mouth sores, tonsillitis, and when the first teeth became apparent. An older adult, ask about mouth dryness related to medications, tooth loss, altered sense of taste and smell, and self-care activities. To obtain objective data, begin by inspecting the external nose. Observe for symmetry, deformity, inflammation, or lesions. You want to begin by testing the patency of each nostril to reveal any obstruction. Next, inspect the nasal cavity with a nasal speculum, noting the color and integrity of the nasal mucosa, and check the septum for deviation, perforation, or bleeding. Also observe the turbinates to check their color and detect exudate, swelling, or polyps. Complete the assessment by palpating the frontal and maxillary sinus areas, identifying any areas of tenderness. Now look at the mouth. Use a tongue blade and pen light. Inspect the lips, teeth, and gums, tongue, and buccal mucosa. Inspect and palpate the uvula. Also check their integrity and mobility as the person says, let's test this cranial nerve 10. Now let's look at the throat. Inspect and grade the tonsils and inspect the pharyngeal wall, noting its color and any exudates or lesions. Test cranial nerve 7 by having the patient stick out the tongue. If indicated, also assess the gag reflex, which tests 9 and 10. Remember to perform developmentally appropriate assessments. For example, in a neonate, palpate to assess the integrity of the palate as well as the sucking reflex. In pregnant women, assess for gum hypertrophy. Older adults may also have evidence of extensive dental work, worn teeth, and loss of subcutaneous fat in the lips and cheek. Incorporate health promotion in your assessment of the nose, mouth, and throat. For instance, if the patient uses smokeless tobacco, these processes increase the risk of oral cancer. Review the early signs of oral cancer with the patient and discuss other effects of smokeless tobacco, such that smokeless tobacco use is not a healthy alternative to smoking. Okay, so that is everything. That lasted a total of 15 minutes. That wasn't too bad. Could have been done earlier if I didn't read all this. But yeah, I thought it was important. Hope y'all enjoyed.